Colonel Gaurav. This is the Global Digest think tank group. You are our guest today.
I do a lot of things. I am currently in India. I am in the state of Uttar Pradesh. I stay in Lucknow, and Lucknow is the capital of Uttar Pradesh. Being retired from the Indian Army in December 2020. What I am doing currently is that I am a senior consultant with the National Disaster Management Authority of India, and I am a external faculty in the subject of disaster management and chemical, biological, radiological, and nuclear threat and assessment with the School of Internal Security and Smart Policing at the Rashtriya Raksha University.
I
So these
see.
are the two major things that I do currently after my superannuation.
I see. So you used to be in the army, not in the navy, right?
Yes, I was in the Indian Army. I served 30 plus years in the Armored Corps. I commanded 50 Armored Regiment, and I've been a staff officer for many, many years after having finished my command.
I see. Usually people send or deploy army first if any disaster cases to deal with disaster issues. So since you are army background and also expertise in disaster, you have any direct experience in disaster management cases?
If you call the COVID pandemic as a disaster, which it was in some ways, then I was directly involved in the management of the COVID disaster, specifically the COVID vaccination, which India was a pioneer in. I was at that point in time the state lead for the Clinton Health Access Initiative, which is a subsidiary of the William J. Clinton Foundation based out of US. I was handling the routine immunization program for Clinton Health Access Initiative when the COVID happened. And most of the routine immunization which we were doing was for the children below 1 year. So that point in time, once the vaccines were made available, then the entire health machinery of the state was diverted towards vaccination, that is the COVID vaccination, and the routine immunization was put on the back burner. So that is one incident where I have been closely associated, and I have been a part of the state task force. I have been part of the discussions to ensure how we can minimize the exposure to COVID, to the general public, to schools, to colleges and universities. And subsequently, when the COVID was dying down, the whole idea of coming out of the quarantine or coming out of the lockdown and starting normal working again was itself a daunting task. So I had written a fair amount of papers and articles and guidelines to ease that job for universities, for colleges, and for the government. So that is one exposure that I have of dealing directly with a crisis. The finances for the program were being made available, and the medicines and the vaccines were being made available by the Government of India, by the Directorate of Health and Family Welfare of UP. And we were trying to streamline the whole vaccination process, which is very well entrenched in the health setup of the state and of India. But no system can be perfect. So improvement is always possible. And those were the improvements, small tweaks, small improvements, small data analytics programs, which we were trying to implement so that the coverage, the full immunization coverage for children goes up, and we have maximum children being vaccinated without anybody being left out. Also, for the mothers who were pregnant, the routine checkups, the medicines, the nutritional advisories, those were also a part of our project. Over.
I see. So you work mainly in UP state or you also work in other state?
I was mainly in UP, but the program was being run simultaneously in three states, in Bihar and in Madhya Pradesh. So we were actually looking at the three largest states of India, and a scale up would have been possible post these pilots.
Right. I mean, India is very populated country, especially UP, Bihar. Those are most populated states in India. And during COVID, I mean, COVID disease is, transfer from human to human relationship. So then in this overcrowded population in UP, how you can able to manage and overcome COVID disaster disease?
So, see, John, the heightened population was not a problem because lockdown had already been imposed. So, whoever was wherever was supposed to remain inside, remain enclosed, and not come out. And people who were affected by COVID were being quarantined, they were being hospitalized, and they were being kept separately. So, the additional population that you are alluding to was definitely a problem, but it did not create much of a problem because once the lockdown was in full force, then there was no problem. All those people who were getting affected by COVID were being taken away to the hospitals, and the balance population which was not affected was left as it is. In any case, vaccination for everybody was being mandated. Everybody was getting vaccinated. We went through three cycles. Some of us even got four vaccines with the booster doses, the first major vaccine, and then two or three booster doses. So that population definitely was a problem in the sense that you had to vaccinate so many more people, but otherwise, I don't think that was a problem.
You see. So which means you want to say in UB state, you can able to manage COVID disaster on time and before massive transmitted COVID disease to the whole population. Uh, you are able to prevent it or protect that COVID disease uh, as soon as possible, or it means you can prevent it earlier. If you are late after massive COVID disease spread out the society, it will be not easy to cope the situation, right? So you want to say you are able to manage and you are able to prevent it earlier than expected.
Yes, we were able to prevent the spread to the large population that you are alluding to. And because the lockdown was in place from March of 2021, there was a sense of well-being, there was a sense of security. And in another 6 months from then, we had the vaccines available. So people were getting vaccinated, and whoever was getting vaccinated had a sense of being looked after, being protected, and that also added to the avoidance of a panic situation, which might have been possible in case a larger number of people would have got affected. I think the damage was equally distributed to all the 28 states, and the center machinery was actually ensuring the distribution of advisories, the distribution of the vaccines, to all the states. So I think the effect of the vaccination was being felt pan-India, and there was no particular state which was being left out. So
Okay.
everybody, obviously, till the time the vaccines came in, we didn't know what was facing us and we didn't know how to tackle it and we didn't know what was the regimen, what medicines were to be used, how was a person to be quarantined, how was he supposed to be kept aside. So once those things came and that knowledge became common and we learned as we went along, and once we had that input, then we were able to put the relevant advisories in place, and then there was a, a system which was built in where anybody who was exposed was kept separate for 14 days. After he was quarantined for 14 days, he could come back into the mainstream. And those things were done in a manner that it did not adversely affect any particular state too much. So I don't think there is, I'm sure if you go into the data, you'll probably, when you see the list, you may probably come up with, this particular state had the maximum deaths in terms of the percentage of population which was affected.
I don't know in India how disaster spread or initially spread among the population, and maybe in many other country, maybe disaster can be uh, easy to spread among social relationship. Where are most initially spread
No,
disease?
the contact tracing was being done at all levels. So the initial people who had got affected were because of the people who were coming from foreign countries from where they were carrying the virus and it came to India. So that obviously could not be detected at that point in time because there was no regimen in place. We didn't even know that a virus like that existed, and we did not know that what will the effect of that virus be. But once that data was clear, once we knew that what is it that is causing all this problem, and the lockdown was successful, the lockdown was very successful. That is what I want to highlight, that the manner in which the government took the step and ensured that the lockdown would be implemented and nobody would be allowed to go out. We made necessary arrangements for the food products and for the provisions to be provided to the people wherever they were. So those things which were done was what actually helped us survive these critical days. But going back to your question, the maximum number of people were being uh, were catching the virus, if I can use that phrase, at their workplace. And it was basically in the workplace or in educational institutions or in the schools. But then once this fact came to be known, then all the universities closed down, the schools closed down, the residential schools told the children to go back to their parents, the hostels were vacated. So things were taken care of while it still did not cause too much damage. Obviously, there were deaths. Obviously, there were people who died. There were people who got severely affected. There were families who had people dying near and dear ones. But then COVID obviously left a large number of households devastated.
As you said, you did very good and on time lockdown, so it can prevent a lot of disaster, uh, COVID disaster, COVID
That's right.
diseases. So that's a good point. And in India, UP is biggest state, but you can able to manage it and overcome COVID disaster.
I have had exposure of the Bhuj earthquake and of the floods in Punjab as a young officer of the Indian Army when the Ghaggar River breached the banks and the city of Patiala was flooded. I was a captain at that point in time. I'm talking of 1990. And that is the time when I got involved in the actual delivery of relief to the people who were stuck. We were moving from our camps, going into the public where the floods were devastating the households, and we were trying to provide relief as much as we could. So that was in the 1990s, and subsequently later in the 2000, when the Bhuj earthquake was actually, it happened on 26th January. We were watching the telecast of the Republic Day parade. That particular Republic Day parade, my own regiment tanks were being displayed, and they were part of the parade in New Delhi. And we were all sitting down watching that particular event when the Bhuj earthquake happened, and we actually felt the Bhuj earthquake. We were in Rajasthan, we were not very far away from the epicenter, but we were not directly affected, and the army obviously, by virtue of its omnipresence, gets involved with relief. I particularly did not participate in that operation, but the Indian Army did.
In Indian Army, how's the readiness of uh, disaster disaster management or disaster response? Example, all this disaster supply or material or medicine or food or water, anything. How's coordination when you was respond to the flood?
So that's a good question. See, the Indian Army, as a matter of routine, is self-contained for all its logistical needs, all its supplies, all its logistics, all its fuel, rations, lubricants, medicine, water, everything, it is inherently available. So there is this concept of zero responder, first responder, and second responder. So zero responder, as you would know, you are sitting in a office, and let's say one of your colleagues suffers a seizure. Now, for that particular person, the colleagues who are around would become the zero responder. So the whoever is the person who actually reacts first, anybody in the vicinity, would become the zero responder. The first responder would then be the hospital ambulance or the nursing assistant or whoever is the medical officer available or has been called. So he becomes the first responder. And thereafter, the police and the army and the NDRF become the second responders. Now, coming back to your question, the manner in which this whole thing happens is that the India as a country has the National Disaster Response Force. We have a large number of battalions of the National Disaster Response Force distributed all over the country with specific operational areas allocated. These forces are the ones who actually get activated based on a requisition from the state duly approved by the NDRF and the NDMA. And that is where the NDRF team, it is a team, every battalion has 18 teams. So, depending on what is the severity of the incident, the NDRF gets activated, and every state also has something known as the SDRF, that is the State Disaster Response Force. So, in terms of hierarchy, the zero responder becomes whoever is in the vicinity. Then, if the disaster requires a larger force to handle it, then the SDRF comes in. In case even more competent or even more larger resource is required, then the NDRF come in. And all this, while it is happening, the Indian Army, the Indian Navy, the Indian Air Force, and the Coast Guards, all four under the aegis of the Headquarter Integrated Defense Staff, we also provide all resources. So, in case there is a uh, let's say there is some evacuation required for people from place A to place B. So whether it is by air or whether it is by helicopters, whether it is by ship, then the Army, Navy, or Air Force actually get involved, and we ensure that the resources of the Army are provided without looking over our shoulders, and immediate assistance is provided by inherent resources. And once the resources which were available have been exhausted, that is, by that time the state actually kicks in, and the other neighboring states or the center, they all start providing the resources. So initial is by the organic resources, and subsequently the state and the center kick in.
Apart from army, I guess maybe India government also has disaster department or disaster ministry.
There is
How
no ministry per se. There is the National Disaster Management Authority. It is authority which is the principal umbrella under which all the disaster management activities happen. There is a Disaster Management Act of 2004 which mandates all the powers and all the authority to the NDMA. And in addition to this, the disasters have been specifically allocated to various ministries. So let's say the drought, the Ministry of Agriculture will look after. The floods, the Ministry of Water Resources will look after. When I say look after, the technical expertise will come from that ministry, the resources will come from the NDRF, and the management will be via the NDMA. And the Army, Navy, Air Force, all the three defense services along with the Coast Guard will always pitch in. So that is how it happens. And every disaster, India is one of the few countries which has actually delineated five major heads and 35 different types of disasters. And each of the disasters is allocated to a particular ministry. It is associated with a particular ministry. So let's say there is a nuclear power plant accident. So that is looked after by the Ministry of Atomic Energy, and so on and so forth. So there is a fair amount of expertise which is inherently available, and the resources are inherently available to tackle any disaster situation. Over.
I see. I see. So it means you don't have a single disaster minister to handle all of them, but instead
The,
all these disaster are allocated to different minister in the government. And you said national disaster management is main coordinating any disaster, right?
that's right. Also, probably I missed out, but then there is the Ministry of Home Affairs, which is the coordinating agency for all both national and international humanitarian assistance and disaster relief operations. So the umbrella is of the NDMA and the MHA, and thereafter the expertise flows in from various different ministries.
I see.
Whenever a disaster happens, many actions are taken simultaneously. So it is not a staggered thing that first this will happen, then that will happen, then. So the international resources, international aid, international help also starts flowing in while the disaster is still developing. So there are many, many countries whom we send help to. There are many countries who are kind enough to send help to us when we are affected by a disaster. And it is a joint responsibility of humanity. Disaster can affect anybody, and we must all stand shoulder to shoulder. Whenever there is a problem, we should all pitch in, and we should all ensure that there is minimum loss of life, there is minimum damage to the uh, to property, there is minimum disruption of life, and we are able to revert back to our normal livelihoods, to our normal way of life as soon as possible. Over.
Right. Right.
We are not independent of the state. So we are actually a integral part of the state health resources. We are integrated with them. The manner in which the grant is coordinated is that we become a part of the state machinery. and hence we are not considered separate from the. So despite the fact that we are part of a non-profit, we are the part of Clinton Health Access Initiative, but our synergy with the state government was such that if the state government was doing it, we were part of it. If we were doing something, the state government was part of it. And that is the kind of synergy that we actually require when we are tackling a disaster. We cannot have piecemeal silos response where one person is doing something the other person doesn't know, or the other organization doesn't know what the first person is doing or the first organization is doing. It has to be a synergistic effort to tackle the disaster, to get it done and over with as soon as possible, minimize the loss of life, minimize the damage to property, and get back to normal way of life as soon as possible. Over.
Okay. As you said, India has managed very well and developed the disaster act, any legislation and legal system, so it will be more effectively. You can prevent any disaster. India government has any interest to cooperate or dealing with disaster in the region or internationally?
Very often that the Indian government is amongst the first to send aid to the neighboring countries and also to the countries in the region whenever there is a disaster which is affecting any country. We are
Right,
probably the first, amongst the first people to stand up and be counted, whether it is in terms of sending manpower, whether it is in terms of sending resources, rations, medicine, blankets, generators, water, whatever. Whatever is the requirement of the country which is affected by the disaster, the
right,
Indian government is always prompt in responding, and you may probably have a look at this guideline that I had written last year for the National Disaster Management Authority, where we have given out a very detailed flow chart of how an international humanitarian assistance and disaster relief activity will be coordinated whenever there is a request received by the Indian government. So there is a document which is specific, engineered to tackle any such request which comes, and we are honor bound to provide resources, manpower, and whatever else is required to ensure that the situation is righted in the country where the disaster has arrived. Over.
right. So I saw many times Indian Air Force, especially right at the beginning of disaster, earthquake or flood.
That is because of the speed of operation and because of the scale at which they can move resources from place A to place B. So both those things are valid both for the Indian Navy and also for the Indian Air Force. And both these arms are utilized the way it is required to provide assistance within the country, outside the country, within the region, and wherever they are, wherever there is a requirement. UNDRR is a global umbrella organization, and obviously the government of India, India is a part of the UN. So by virtue of that, there are very deep linkages that the NDMA, the MHA, and the government of India has with the UNDRR, and whatever guidelines, whatever instructions are issued by the UNDRR, they become the gold standard for us to take and contextualize those instructions to our country and then ensure that the disasters, as they were to happen, are prevented from happening. And if disaster risk reduction is possible, then we don't need disaster management. So if you
Right,
can reduce the risk of a disaster and ensure that the disaster does not happen, then there is no requirement of managing the disaster because the disaster will not happen. So
Right.
if there is a hillside where you find that there is a lot of deforestation, and because of that the hillside may suffer a landslide if there are torrential rains, then the answer to this solution is not to wait till the landslide actually occurs.